Okay, guys, I'm really excited to be back in Tel Aviv, and I hope that I will be worth your while because I realize this is a Thursday evening and you could also be doing something else, like having a glass of wine on a terrace somewhere on a beach. You have such beautiful beaches and such amazing places, and I'm really happy that I have been enjoying your beautiful country for a few days now. I went to amazing places with Orit, went to Nazareth, to Haifa, to Caesarea. We had an amazing time. So thank you for inviting me here, Orit. I really, and Ilan, I really appreciate this. So today, I will talk to you about how to make your treatments as safe as possible. Because even though complications with fillers are rare, they do occur. And to prevent them, to make them even more rare, we have to think about what can go wrong. And therefore, we have to choose the right technique for our treatments. And also, to create the aesthetic result, we have to choose the right product with the right characteristics in order to give us that aesthetic result. So that's what I'm going to talk about. They asked me to talk about products. Now, I'm not going to talk about products. I'm just going to talk about how you can create beauty, because we're all colleagues here, and we are interested in making our patients happy. So therefore, I think it's more interesting to talk about anatomy, to talk about product characteristics, and to talk about what is beauty and how can we create it. So before I start, I would like to draw your attention to two things. One is, so that's me. One is a course that I'm conducting in, where's my pointer? Where's my pointer? Come on, guys. No pointer? Here we go. This is glitching. Okay, I have another one. One is over here, 12th of September in Amsterdam. This is a master class, advanced indication, hands-on course in my clinic in Amsterdam. You're very welcome. I know that a lot of you would jump to the possibility of coming to Amsterdam, not maybe because of a course, but maybe because of other reasons. But this is your reason that you can come and explain to your wife or to your husband why you are coming to Amsterdam, even though the real reason might be something else. Then the other thing I would like to draw your attention to is the European College of Aesthetic Medicine and Surgery. We do every year, we do 2 or 3 times cadaver courses. The next one is going to be in Verona on the 31st of July and the 1st of August. Then in October, we will have one in Bangkok. I could tell you the same story about Bangkok that I told you about Amsterdam. All right, so all these facial indications that we can treat with all these products, you know, we have to think about every individual area in the face and think about all the anatomical structures in order to avoid the possible complications. But actually, our patients, they are not really interested in all these products. They're not interested in all these techniques. Our patients are interested in beauty. And if we want to understand what our patients want, then we have to think about what is beautiful. So I was working together with a makeup artist, and the makeup artist really opened my eyes to how they create beauty with makeup. You've seen pictures of a very average woman before makeup and a beautiful, stunning model after makeup. We've all seen these pictures. And they work with light and shadow. They put highlights in specific areas in the face, like the forehead. They put some highlight, they put some shadow over here, they put highlights over here at the brow, and then the cheek and the interior face, and they put shadows here at the jawline and underneath the cheek. And so with light and shadow, we can create beauty. And the nice thing about our profession is that we can really give this to our patients without makeup. We can give it to them for real. Can you see it from there? Is it okay? All right. So thinking about what is beauty. Can I see some hands in the audience? Who thinks this is beautiful? I saw one. No? Nobody thinks this is beautiful? Is this beauty? No, this is big lips, right? But I'm sure that this girl thinks it's beautiful because she's very proud. She posts this on Instagram. I found this on Instagram, and I thought it would be interesting to share it with you because people want to be more attractive. And they think that they will become more attractive if they put fillers in their lips. And it's true that they become more attractive. But then they think, hey, that worked. I became more attractive with a little bit of filler. Let's do some more so I will become even more attractive. Now, that's where the logic kind of goes wrong, and they end up with lips like this. So ask your patient, do you want to be attractive? Everybody will say yes. And that's your opportunity to start talking about what is attractiveness, what is beauty. And you can talk about the balance in the face and how the harmony of the different elements of the face have to be correct, have to match. Another example. Have you ever had a patient who came with a picture of Kylie Jenner and asked you, can you give me lips like this? Or they come, yeah, you've had that. I've had that multiple times, especially the younger generation, the millennials. And they have all these apps in their phone, and they take selfies, right? And they change their face with Facetune or other applications, and they ask you, can you make me look like me that was photoshopped or altered with Facetune? This is the reality of today, guys. This is what we have to deal with. And so we have to sometimes make these patients come back down to earth and understand reality. Now, I would like to give you an example of what happened to me like a few months back. This girl, she's like mid-20s. She told me that she went to see a few doctors before who had injected filler in her lips. And then she heard some friends talk about me, and then she decided that now it was my turn to inject her lips. And this is what she looked like when she came to see me. And I said, beautiful, beautiful young woman, if you would like me to inject your lips, it will not be a filler. It will be something else that will reduce the volume of your upper lip because it is out of balance. It is out of proportion with the rest of your face. And I sat her down and I explained to her that I am a professional in beauty. I know what attractiveness is. I know about facial harmony. And she listened to me. And so she allowed me to put some hyalays in her lips. And she allowed me to also put some products in other areas of the face where I thought I saw that she could have an enhancement in facial harmony. So I injected these different products. These are Belotero and Radius. See, this is Belotero Intense in the forehead, in the frontal concavity. This is Belotero Intense in the nasal dorsum, in the subsmas space, so on the periosteum, perichondrium. Belotero Balance in the tear trough, Belotero Volume in the cheek, Radius in the mandibular angle. A little bit of Belotero Intense here. And you see that after this, she looks like this. Can you see the change? She's already pretty beautiful here, but she looks a little bit insecure, a little bit tired with an overinflated lip. And now she has facial harmony. Her forehead has a beautiful convexity. Her nose has a very charming, small element to it. There's much less tiredness under her eyes. She has a very attractive, youthful cheek, and her lips look proportionate. So again, you know, looking at light reflection is something that we have to do. We have to play with light. We have to be the makeup artist. We cannot look down on makeup artists. We have to actually look at them and see what they are doing, because they have been studying light and shadow their whole careers. We have been studying arteries and veins and nerves and muscles, you know, but they know about beauty. So with the Belotero portfolio, and now I'm going to give you a product slide, we can use the product characteristics in order to give us what the patients need. Sometimes we just need lift, sometimes we just need volume, sometimes we need contouring, and we can use these different gel characteristics of these products to give that result to our patients. This is the whole Belotero range, and as you can see, there may be some products that you haven't seen before, like Belotero Revive, right? This is the latest product, the newest product. This is a skin booster, and you know, this is just like the other skin boosters on the market, but of course it also contains glycerol as apart from hyaluronic acid. It's cross-linked, it's in a minor way cross-linked. Then there's two other products that are Belotero lips. So it's actually one Belotero lips with two different flavors, because Merz has realized that for lip augmentation, it's not one product that will meet all your needs, because you need some volume in the lips, you need some definition of the lip contour. So for the volume, they are giving us Belotero lips shape, and for the contour, they're giving us Belotero lips contour. So these are actually two different products for lip augmentation, and it's exactly what we need to create beauty. So if you think about it, what we need to get, what kind of effect we need. If you need skin quality improvement, then of course Belotero Revive. If you want to fill fine, very superficial wrinkles like crow's feet, then we need Belotero Soft or maybe Belotero Balance. But if the wrinkles become deeper, then it's Belotero Intense. And if you want to lift, push the tissue up, if you want to actually change the position against the gravity, lift it by injecting in the ligaments. And that's what I'm going to talk about when I talk about cheek augmentation, about ligament lift. Remember this, and that's Belotero Intense. Or maybe Radius Plus, but we're going to talk about Radius a little bit further too. Projection, Belotero Intense. Volumizing, Belotero Volume. The amazing thing about Belotero Volume, which is probably the most special injectable in this whole portfolio, because Belotero Volume is a very strong volumizer, but it's a very soft one. So it feels like fat, and it's what it's designed to feel like. So if you inject Belotero Volume in a cheek, the patients are not going to be able to feel the filler. Sometimes there's a little bit of getting used to, because if they're used to the very stiff products that are very thick, they actually feel them. But with volume, they might say, have you injected something, because I cannot feel anything. But actually, they are a better volumizer. Belotero Volume is a better volumizer than a product like Juvederm Voluma. We'll talk about that a little bit later too. And then contouring, shaping, creating shadows, Belotero Intense, or Radius. So with Belotero, you can do many, many things, and this is my general standard protocol for a global facial approach. And we're going to talk about all these techniques, all right? So this is basically the summary of what I'm going to talk about today before we start injecting the patients on that beautiful massage bed that I might need later on. So what is a perfect hyaluronic acid? The perfect hyaluronic acid means that you have a very low immediate reaction, so limited swelling, right? We all hate malar edema. We've all seen it, but we hate it. So limited swelling, also directly after the treatment, low direct irritation. But also on the long term, we see much more problems with some products on the market, and we want our product not to give us any problems later on. So the immunological reaction that we may see after a few months is actually possibility of a delayed reaction, delayed inflammatory reaction to a product, because it's a foreign body. So then the immune system may start to react against that foreign body. Also, you know, like in the ideal world, we would have a filler, we would have an HA, that if we inject it, we would not be able to actually feel it. So it should be very low palpable, like bilateral volume that I just talked about. But in the same time, we need products that actually give projection. You know, if we want to have a good cheek augmentation, then we want it to be projecting also the cheek or the nose or the chin, right? We need to give projection. Of course, we need to respect facial mimics. If we smile, it has to look normal. These muscles cannot be, let's say, inhibited by the presence of a gel. So we are challenging these pharmaceutical companies to give us these products with all these characteristics that we need. And, you know, finally, Belotero is one of these products, portfolios actually, that is giving us all these things that we need. And the difference between the other companies is that, you know, the cross-linking process. So all the products start with non-cross-linked hyaluronic acid. Then all companies do kind of the same thing. They use BDDE as a cross-linking agent, and they bind the molecules together. This is where most companies stop. But where Merz continues is that then they will put the gel into an electrical bath and apply another washing of non-cross-linked hyaluronic acid that will bind the unbound BDDE. And therefore, you will get areas that have high density of cross-linking areas and low density zones of cross-linking. And that will result in, you know, depending on how much BDDE and how much time they will let that reaction take place in different products with certain cohesivity, elasticity, and plasticity. And all the products of the Belotero portfolio have these characteristics in them. So soft and balanced are meant for very superficial injection, while intense is meant for, let's say, deeper folds, and volume is meant for volumization, obviously. So this is an example of Belotero balance. This is actually maybe soft even. And you see the blanching technique. This is something unique for Belotero because you can inject it so superficially that with all other products that are on the market today, you would see nodules, little bumps, because you are injecting it so superficially that it would be visible. It's so superficial that you see kind of a temporary blanching. You see that the skin turns a little bit pale, a little bit white. And it's because the gel compresses the papillary blood vessels that are in the skin, in the papillary dermis. So there's a temporary compression of these vessels, and it will last approximately 10 minutes, and then they get reperfused. So there's no necrosis or anything. It's just a temporary compression. And this is unique because no other product is able to do this, and it has to do with the cohesivity of the gel. It just goes in between the cells and not accumulates in a big ball. All right, that's very short about Belotero. Radiesse is a different story. Radiesse is not a hyaluronic acid filler. It's a biostimulatory product. And if I'd have to give you my standard protocol of combining Radiesse and Belotero, then this would be the slide for Radiesse. Radiesse, the best indications for Radiesse are skin quality improvement. You see here diluted Radiesse. And you see these entry points over here. It doesn't matter where you put the entry points. As long as you put a thin layer of Radiesse diluted, 1:1, or 1:2, at the dermal subdermal junction. And then that calcium hydroxylepatide, which is the active ingredient, will start to stimulate the fibroblasts, attract the fibroblasts, and stimulate them to produce collagen. And slowly but surely, the skin will become tighter and tighter. And the non-diluted radius, the radius plus with full viscosity, you can use for contouring, and that's especially amazing for jawline recontouring, mandibular contouring, and that is actually the best thing that you can do with radius, non-diluted. In between the red lines you see here, again, diluted, 1:1 usually. And radius is actually probably my favorite product. It's been on the market since 2003. And since that time, we started off injecting in the nasolabial fold, but soon we discovered the cheeks, and then soon we discovered other lateral areas like the temples, and we went down to periosteum, you know, and then we started discovering the cannulas, which were safer than needles, and treating especially the lower third of the face, the mandibular recontouring, but also we're injecting it everywhere else in the face, like advanced indications like tear trough and nose and even the forehead in the subgaleal space. And then we discovered non-facial areas, like the hands, like the arms, and we started hyper-diluting until it's almost liquid for neck rejuvenation, décolletage, abdominal rejuvenation. Because, you know, even though radius normally has 30% of the product is microspheres, calcium hydroxylepatide microspheres, it's in a suspension in a gel carrier, a carboxymethyl cellulose gel carrier. It's 70% of gel and 30% of calcium spheres. Now, these calcium spheres are human minerals. So we have them in our body already. So calcium hydroxylepatide is a human mineral that we have in our bone and in our teeth. So it's very biocompatible. It's been used in a lot of fields in medicine. So if we inject this product, 30% of what we are injecting is actually consisting of this calcium hydroxylepatide microspheres. 70% is that cellulose gel, but that cellulose gel degrades really quickly. So from 70%, it goes down to 0 in about 3 months, and then it's gone. In the same time, these spheres are going to attract the fibroblasts, and the fibroblasts are going to produce collagen so much that the 70% is going to replace the volume that was lost from the gel resorption. So eventually, you will have 100% correction from the beginning that you inject until 3 months later. Even though underneath the surface of the skin there's a change from gel to collagen. So what's actually happening is that we have a creation of human tissue because of this product, right? That this is what it means to have a biostimulatory product. Now over time, then of course the spheres get degraded, the extra collagen production becomes lower, and the augmentation goes down as well. All right, so this is a non-permanent product. There is no more evidence of product if you wait long enough. And it can last up to 2 years sometimes, but I never promise my patients more than 1 year. Because it's better to under-promise and over-deliver to keep your patients happy. So what we can do with radius is turn this old, fragmented collagen architecture back to that youthful, beautiful, strong network of collagen that we have in our youth. And it's so amazing what we see in our patients, that if you have this old laxity skin and you treat it with diluted radius and you wait half a year, the patient comes back and you feel it again. It feels so firm, so healthy, so strong, but it's not because it's not just collagen that is being produced. Now, on all the literature that I have read about radius, this is my personal interpretation. So this is not published or anything. This is something I made because this is the way I understand the mode of action. So the sphere is 25 to 45 micrometers in diameter. The macrophages cannot endocytose this big sphere, so it starts firing acidic molecules. So it becomes smaller because the chemical reaction is that it splits into calcium and phosphate ions. And the calcium ions go through the calcium channel and activate the fibroblasts. High concentration of calcium means fibroblast activation. So, and then finally, the sphere can be enocytosed and phagocytosed, right? And it all gives calcium Ca2+, giving fibroblast activation. And that means that we have production of collagen, which gives us the volume and the correction of the fold, but also production of elastin, creation of new blood vessels. It results in creation of hyaluronic acid, because hyaluronic acid is also made by fibroblasts. And the interesting thing is that injection of radius induces differentiation of the fibroblast into a myofibroblast. And now you can understand why we see that lifting effect. Because if the fibroblasts turn into myofibroblasts, you can understand that this gives a tightening of the skin. And so what we see after doing this, it really works. There is superficial radius, diluted radius. This is a 1-to-1 dilution. Diluted radius, we put it just at the dermal-subdermal junction, right? Underneath the skin, advancing the cannula carefully. This is a very old skin that's very fragile and it's easy to bruise. And we just put a thin layer of radius with as much contact as possible to the reticular dermis. And so we take that 4-point cannula technique and place 1 syringe of diluted radius on one side and 1 syringe of diluted radius on the other side, which means 1 syringe is 1.5 cc's. So you inject 1.5 cc's of radius mixed with 1.5 cc's of saline. So there's 3 cc's per side, right? That's the standard protocol for a skin like this. And that's giving an amazing rejuvenation. And over time, and I'm going to show you a picture now of a patient that I've been treating for about 6 years. And I've been treating her with radius and a little bit of superficial blanching technique with Bellatero. But this is an amazing result. You know, this quality of the skin is astonishing. I'm really surprised. Sometimes I cannot even believe it myself, the effect that this product has on the skin of the patient. They look so healthy and the skin looks firm and really rejuvenated. Another area in the face is just actually not really the face, but just on the lower part in the neck area. This is where if you start injecting the neck, you will make a lot of people very happy. I usually use 1 part of radius and 3 parts of saline, always with a little bit of lidocaine, right? So as you can see, this is my protocol. So there's a 1 to 3, 1.5 milliliters of radius, 0.5 milliliters of lidocaine, and 4 milliliters of saline. So together, this is 6 milliliters per side, right? So there's 2 syringes necessary for complete neck rejuvenation. And the treatment is relatively simple. Just get your cannula or your needle. You can do it with a needle. It doesn't matter. Whatever you feel comfortable with, as long as you give a very nice and even, let's say, like a deposition of diluted radius, just in the skin or just underneath the skin, and that will stimulate those fibroblasts to rejuvenate, give you all those effects that I mentioned earlier. As you can see, this is an orange cannula. So this is a 25 gauge cannula. And I've kind of learned that in the neck, the 25 gauge works very well because it is not so painful as the 22 or 23. Somehow that thickness, when you get thicker in the neck, it becomes more painful. And the 25 is thick enough not to cause a lot of bruising and thin enough not to cause a lot of pain. So as you can see, multiple deposits. Now this is a result of neck rejuvenation with radius. So what I have done here is inject a filler into the submental area and into the neck area. This is the before picture. You see here how the skin is sagging down. This is the after picture. And I have put weight there. I have put weight with my filler in the submental area, so if it wouldn't have improved that skin quality so well, then of course it would have fallen down further. But as you can see, because of the skin tightening, collagen production, elastin production, differentiation into myofibroblasts, you see that it really turned out to stretch it very tightly into a beautiful result. Also, if you feel it, ask your patient to feel the skin before the treatment. When she comes back, ask her to feel again and say, remember what it used to feel like. She will be really astonished. Of course, I'm cheating a little bit with this image because I've also treated her in the upper face. So I've treated her in the cheeks, mandibular definition, mentum augmentation. So if you treat them all over the face as well, then of course it will have some effect on the submental area and the neck. How many milliliters? This one. Wait. Sorry. This one you mean? 3 milliliters of diluted radius in the neck. So 1 syringe per side. And in the upper face, I think it was 2 syringes per side. So, expensive treatment. It depends. Is it expensive if you get a result like this? I don't think so. I think, whatever it costs, you want this, right? Okay, so when do we choose bilateral volume and when do we choose radius? If we want projection volumizing, then we choose bilateral volume. If we want skin tightening, lifting, contouring, then we choose radius, right? Especially for men. Radius is the #1 filler if it comes to male patients because they always have a good collagen reaction. They don't have a reduction of their estrogens that are sometimes a problem with our female patients. Okay, guys. So this is the little bit of a background to radius and bilateral. Now let's look at how we can use these products to create beauty. Remember the beautiful young women with the lip in the first slides, right? You saw that I injected her forehead, right? So I corrected her frontal concavity. The older you get, the deeper it becomes. So the frontal concavity is evidence of bone resorption. And evidence of bone resorption, guys, is evidence of aging. The older you get, the more bone resorption you will have. And therefore, if we can hide that evidence of bone resorption, we can make somebody look younger without anybody understanding why the person looks younger. So the frontal concavity is one of these magic places that we can inject in order to make our patients look younger. But if you inject fillers in the forehead, you are injecting a filler in the third most important areas that have been associated with blindness after injection. Okay? So if you have started injecting, just wait a little bit till you get really, really comfortable with the cannula. Don't inject with the needle in the forehead. Just use a cannula, all right? Just use a thick cannula, at least 25 gauge, preferably even thicker, 22 or something. And know your anatomy, right? You know when you have to be nervous, all right? This is a really tricky area, and there is a patient that I will be injecting later on in the forehead, and I will talk to you about every little detail, all right? So the details are, know where the arteries are. So this is a supraorbital artery. Over here is a supratrochlear, it's not drawn. And over here it's deep, it's coming out of the orbit, so it's on the bone going through the supraorbital notch, and then it becomes superficial. So it's going superficial to the subcutaneous plane. So in the first 2 centimeters above the supraorbital rim, it could be in any depth. It could be deep, it could be superficial. Above that 2 centimeters, it's always superficial, right? So we know that as long as we get closer to the orbital rim than 2 centimeters, even though we are on the bone, still we have to be careful, right? So this is one. No, that's two actually. Cannula. Two, be on the periosteum, below the galea. There's also not just an anatomical reason, but also an aesthetic reason for being on the galea, because if there's a concavity here, and if you would place the filler subcutaneous and the patient starts moving the brow, then the filler would be moving relatively to the concavity. So it's better to put the filler under the muscle so that muscle can move over the filler. I don't know which one of you has ever done a cadaver dissection? Can see some hands? I know that you have, and I see so many familiar faces here. I've seen so many of you already. But it's so interesting that if you do a cadaver dissection, just take a cannula, take an artery of this cadaver and try to put the cannula in the artery. If you try this, you will think, oh my God, I thought I was being safe with these cannulas. I thought they were not able to get into the artery, but they can. And it's not even difficult to get them in. Especially the 27 gauge cannula is quite easy to get into the artery. But not like a needle. So the needle, doesn't matter how the artery is oriented relatively to the needle can always get into the artery. The cannula can get in, but first of all, you have to fix the artery in a cadaver. You have to fix the artery between your fingers. Second, the artery has to be parallel to the cannula. Then you can get it in. If it's perpendicular, like this, then it will just push the artery aside. So you have to be parallel and you have to fix the artery. If it's not fixed, you're going to push it aside, right? So this is important information for us, because in the face, and you look at here, right? You look at this medial entry point with these retrogrades over here, and you know that the direction of the arteries is parallel here. Then you know that you have to take extra precaution, be a little bit nervous. This is our obligation. We have to be nervous. Beware of parallel direction of arteries with the cannula. Then, another thing that I would like to stress is, what if, even though you're careful, even though you're very gentle, but you would be with the cannula inside the blood vessel, you start to inject the product. It could go to the retina. There's a very interesting study published where cadaver dissection, they measured the amount of milliliters necessary to go from the supratrochlear artery to the retina. Now, these 6 cadavers that were measured, the lowest amount was 0.04 milliliters to reach the retina from the supratrochlear artery down to the ophthalmic artery and to the branch of the central retinal artery. So if we think even with 0.05 we can blind someone, which is the marking of the syringe, 0.05 markings, every marking is 2 retrogrades, which means 0.025. So then, if you would be intravascular, still you wouldn't blind your patient. Also, low pressure, because if you just start shooting the hyaluronic acid against the bloodstream into the orbit, then of course it's easier to embolize the retina. And what I usually do is put some pressure on the supratrochlear artery with my non-dominant hand. All right. So this is an example of a patient, and I've marked her supraorbital artery over here, supratrochlear artery over there, and the white marking is where she needs some product. So you see, I'm pulling up the muscle, pulling up the galea, and then I'm getting the cannula over the periosteum. And so when the cannula is in the subgaleal space, I put the bevel down, and I really want to make sure that I'm subgaleal, because if I'm intramuscular, then I would still be in the territory of possible arteries. So I do retrograde linear threads. And when I re-advance the cannula, I pull up the muscle just in front of the cannula, so that to make sure that it stays on the periosteum. And again, I do very small amounts, like every retrograde is about 0.05 when I'm so far away from the supratrochlear artery. And then, when I get to the midline entry point, I start to become a little bit more nervous. It's okay to be nervous. It's okay. It's our job, We have to be afraid of complications, because if we are a little bit afraid, we start to become more careful. We're not going to just inject because we think we are never going to be, in trouble. So we lift up, advance the cannula, and give a little bit of product. Lift up again. And I always say, we have time. We are not in a rush. Take your time when you're doing this treatment. Really, it's so much better for you, for your patient, to relax, to be gentle, to have a very good tissue handling, and to make sure that the cannula is not entering into a blood vessel. So right now, the cannula is getting very parallel to the supratrochlear arteries. So again, I lift up, make sure I don't pass any resistances. And now I place my thumb and index fingers on the supratrochlear arteries. Not yet. I think this was during a conference in Belgium, so I'm explaining what I'm doing. And as you can see, I put my fingers, I put some pressure on the supratrochlear. And it's also based on a published study where the author showed that if you place your fingers on that supraorbital notch, then the filler is much less likely to actually go from the outside into the orbit. So some extra pressure to temporarily close the bloodstream. All right, so finally, if you inject product in this area, you can see that it's not a dramatic change, right? This is a Radiesse patient. So I injected one syringe, 1.5 milliliters of Radiesse in the subgaleal space. You can also do this with Radiesse, although it's not the general recommendation of Merz. But as you can see, you see how it illuminates the face, how it improves light reflection of the forehead. All right, let's go. I always take pictures after 3 months with Radiesse patients. All right, let's go to the temples. And I think I may be using a little bit too much time. Temporal hollows, becoming thinner, skeletonized. Oh, wait. Okay, can I see some hands? Who uses needle for temples? Who uses cannula? Really? Have I told you the story before? Usually most people say, I just use a needle, put it to the bone. There's a safe spot in the temple. And they say, yeah, because I went to IMCAS and there was a guy on stage and he said that go 1 centimeter up and 1 centimeter lateral, there's a safe spot. All right, let me show you a little video. My friend, Rebecca Fitzgerald, she sent it to me. She's a dermatologist from LA. She sent me this video, right? She puts her needle in the safe spot. And the safe spot is like from the fusion point of the temporal crest to the orbital rim, right? 1 centimeter, 1 centimeter. You don't have Sculptra here, but Sculptra is also a biostimulatory product, liquid. So with liquid, you can aspirate. And so she puts the needle on the bone, right? It's on the bone, and she starts to aspirate. Look what happens. Look, like she's like pulls, and then pulsatile blood enters into the syringe. Pulsatile, what does that mean? Arterial, right? So she's actually in an artery, even though the needle tip is on the bone in a safe spot. So, anatomic variation. There is no such thing as safe spots in the face. Right? There's only places with higher risk and places with lower risk. And aspiration, okay, aspiration, I mean, it's a great way of knowing for sure that you're in a blood vessel if you see blood. If you see blood. If you don't see blood, doesn't mean anything. I did the study. I did an in vitro study with a lot of different products, a lot of different needles, right? All the green is where, okay, is a positive, you know, is a good test. If you aspirate, then you see blood. But the orange and the red, that's all getting a little bit tricky, you know. For example, bilateral balance. Your blood, anticoagulated blood, 27 gauge needle, you have to wait 5 seconds. Who's going to wait 5 seconds? Not me. The standard 30 gauge needle, you have to wait very long, more than 10 seconds. And I didn't wait longer than 10 seconds in this study, so I didn't even see blood with the 30 gauge needle. And we tested all these fillers, like all the Juvederm, you know, the Restylane products, and we saw a lot of red and a lot of orange. So generally speaking, if you see blood, it means something, but if you don't see blood, it doesn't mean anything, because 33% was false negative. Sorry, 33% was true positive. 67% was false negative. So if you use a needle for temple, don't inject more than 0.2. Max. I recommend 0.1 milliliter per bolus. All right, so what I do is this. I take a needle and go to that. Okay, let's call it low risk spot, right? Low risk, no safe spot, but low risk. Down to periosteum, soft touch periosteum. And I don't aspirate, because if I don't see anything, it doesn't mean anything. And I just give little boluses, 0.05 or 0.1, and I just change the position of the needle every time. Right? So if I would be in a blood vessel, it would be a small amount inside, which will not give us a devastated patient. But more often, I use a cannula technique. And I use Dr. Brian Mendelssohn's theory of the anatomical layers. 5 anatomical layers in the face. And the 5th being periosteum and the deep fascia. So the periosteum of the frontal bone is the same anatomical layer as the deep temporal fascia. So if you go on top of the deep temporal fascia, you're immediately underneath the superficial temporal fascia. And that area does not contain any blood vessels. So if you talk about optimizing patient safety, you want to avoid vascular problems, then that is a great place to go, because there is no blood vessels there. And to get there, you can go to the frontal bone with your cannula, the periosteum, and slide over the temporal crest, and you are in the interfascial space. So this is subcutaneous, right? You see, I can lift up the cannula. But then, now I go to periosteum of frontal bone, I click through, I go lateral. Then when I try to lift up, it's not moving. So you see the difference between subcutaneous and subfascial. This in between the superficial and the deep fascia. And now, I can just start giving retrograde linear threads. And if you take a long cannula, you can even go, you know, beyond the hair and really treat the temporal area, lift the brows, and make the hair look fuller. And eventually, if you start off like this, see the holes in the oval of beauty, treat the patient with Belotero, and you see softness of the face. And of course, you know, this is not a very dramatic result. It's just a very natural softening of the face. So this patient looks younger, nicer, less worried, and generally more attractive. All right, let's talk a little bit about the cheeks. There's different things that we might want to achieve when we inject the cheeks. There is volume. We might want to give some volume to the cheeks, Or if the patient already has a lot of volume, we want to create some shadow in the cheek to make the face look a little bit slimmer. Or maybe there's a lot of descent of the cheek, so we want to lift the cheek. So depending on what we want to do, it makes us choose the product of choice. Now this is an interesting picture because it shows us two ligaments that are important. Actually 3 ligaments. One is the orbicularis retaining ligament. 2 is the zygomatico-cutaneous ligament. And 3 is a zygomatic retaining ligament. These 3 ligaments go from the bone deep and insert into the skin or the muscle. If you want to lift, then you can use these ligaments to lift up the cheek. If you feel on your own cheek, you try to press down, pull down the cheek, it's not moving. If you push up, you feel it moves easily. It's because ligaments, they inhibit downward pull because they're already vertical, but they will allow upward pull because, you know, they will be pushed up easily. So we can use this for lifting the cheek. So 1, 2, and 3. So there's 3 types of ligaments that we can lift. So zygomatic cutaneous ligament and zygomatic retaining ligament. The tear trough ligament is basically the fusion of these 2 and the orbicularis retaining ligament. All right, so we want to lift up the SMAS by pushing the ligaments up. So normally I start with a little bit of extra projection over here. This is not ligament lift, this is light reflection, right? So we want to have a nice light reflection of the lateral cheek. A little bolus here, retrograde, little bolus here, retrograde, little bolus here, retrograde. But then we get to the ligaments over here. And as long as we keep on pulling the ligaments up and placing the filler just below it, we create that lift. Also the medial one, we can use the same technique. And so what does it look like? It looks like this. You pull up, and then when you feel some resistance, you pop through. You're on periosteum, you pop through resistance, and then you are just below that ligament. Where is Orit? How much time do I have left? We're done? No more time? No? Okay. In that case, I will. Should we go to the patient then? Because like I have so much more slides. So let's just skip the slides, right? So I think. Would you like me to stop the presentation and go to the patients? Because we can talk about things forever. And but because there's a lot of things that we can also discuss while treating the patient, right? And then we can have some drinks, which is why we are here in the end, right? All right. Okay, I'm there on the bone. Just to finish, I would like to draw your attention to one final thing, and that is this. Yeah, please bring her. I started off my presentation how to avoid complications, right? How to optimize safety for our patients. Orit's mom is going to be the first patient. Mom, come here. But what if something goes wrong? Complications are so rare that for us it can be difficult to recognize them. And if we see something that we don't understand, how are we going to interpret that? So me and my friend Philip Snutzy from Switzerland, we wrote this article. We published this article recently in PRS Global Open. So it means it's in PRS, but it's a free download. So if you go to PubMed and you just type in my last name or Philip Schnotzi's last name, Schnotzi and Van Loghem, then you get to a protocol on how to treat hyaluronic acid complications. All kinds of complications, you know, from bruising to swelling to nodules to infections, and it's all algorithms based on clinical presentation. So you don't have to have the diagnosis yet, just the clinical signs are enough to find your way to the treatment. All right? So this is just for you. This is like what you can use in your office. You have it in a drawer somewhere. You don't have to read it. But if you see something that you don't understand, this is something that may help you if you think, is this a herpes infection or is this a vascular event, right? Because both can have these little blisters that may seem like a herpes infection, but actually it could be that the patient really needs hyaluronidase and not an antiviral treatment. So, thank you very much for your attention.